Let's see here. I was going to go through my top 10 list of things that parents can do to help adolescents, young adults with an addiction or who are starting to dabble in this. That is kind of my wheelhouse. I'm an adult doctor, but my real specialty of research is adolescence and adolescent addiction. And for young adults. And so I actually wrote a book here, Clearing the Haze. And so if somebody wants this afterwards and you think you might read it and benefit from it, just come get me and I'd be happy to give this copy away. So in researching for this book, I read 1 million articles and kind of distilled to the top 10 things that parents can do to be helpful. And so the first one up there, yeah, there it is. Be caring, empathic, emotionally responsive. So there's nothing that replaces that positive, warm, loving relationship. That's how kids grow up to take on our values that you have as an adult. It doesn't mean we're like buddy-buddy, best friends type of thing, but it does mean there's this warm, caring relationship. And so that's number one. Be authoritative. So there's authoritative parenting, there's authoritarian, there's passive. Passive is like, okay, go do whatever you want. Authoritarian is like, it's my way or the highway, I don't care what you think. And then authoritative is kind of somewhere in between, where I can understand why you would want to go to the mountains with your friends with no adult supervision, and I don't feel comfortable with that. Okay, so that would be authoritative. We try to shoot for that authoritative ground. Behavioral control, not psychological control. So behavioral control is basically rewards, consequences. Gee, thank you for doing your homework tonight. You can have an extra hour of curfew because you did all your chores, something like that. Psychological control would be, don't you know what you're doing to your mother and me? Or like, don't you know what you're doing to the family? Or why can't you be more like your big sister, your older sister, things like that. We're laughing because as parents, we've all fallen into this trap, and we just need to be good enough, not perfect, right? Good enough as parents. That's all we can hope for. And by the way, parents can do everything perfectly. I see this all the time, and have a child who grows up with an addiction. So I see it all the time, and I see a lot of mothers, especially with a lot of guilt, and I think that's not so helpful because, again, we're doing the best we can with what we have, and we're trying to be good enough. Let's see here. So self-care, boundaries, co-parenting. So put on your own oxygen mask first, and then put on everybody else's oxygen mask, okay? Don't forget to take care of yourself. Spending time together, I think that's self-explanatory. Be a healthy role model for your own, obviously, substance intake. So parents who smoke and use substances, more likely to have children who smoke and use substances. But that also has to do with just a general healthy life in terms of whatever it is for different people. Clear expectations about substance use. So parents, caregivers, you may think that your teenager doesn't care what you think about this, but they actually do. Okay, so please make it clear what you think and what your expectations are for your household. Even if you're going to get, oh mom, oh dad, right? It still a little bit does get through the surface. And I'm always surprised at how many kids come to treatment with me and they say, oh yeah, my dad doesn't care. He told me how he smoked weed in college and he turned out great, right? So he doesn't care. So I think it's important to make the expectation clear. Require teens to contribute to household functioning. So I think that, teaches responsibility. It also helps people feel important when they have a role in the family functioning, like they're contributing. Using extended family is helpful. And help youth have meaning and purpose. So meaning and purpose, whether that's chess club or sports or something pro-social, very helpful. And religiosity is actually very protective for substance use. So involvement in some kind of religious, spiritual development can be very helpful. That's my top 10. It's in my book here, and which is explained in more detail with references. And I wanted to go through. Do I have just a couple minutes?
Oh, you bet.
Is that okay?
Yeah.
Okay. All right. So do I have a couple minutes? Okay. All right. You're pointing at your watch. I'm getting nervous. Okay. So let's see here. Just as a physician, I wanted to talk a little bit about some of the medications to treat and some of the medical aspects of addiction. So with the opioid overdose epidemic, we have various treatments now: methadone, buprenorphine, naltrexone, to treat this. And I think it's my opinion, I know there might be some controversy here, but really when we're treating opioid use disorder, alcohol use disorder, it's irresponsible not to have a serious conversation about medications to help treat those things. I believe the backbone of treatment for addiction has always been, is, always will be behavioral interventions and life change, that spiritual transformation. But when it comes to alcohol, opioids, I think there needs to be a serious conversation about medications to treat these. Methadone, first studied since the 1960s for addiction, and so we have, 6 decades of data now showing it to be a helpful treatment for opioid use disorder. Same with buprenorphine. We've had that now for about just over 10 years. That's a medication you don't have to go to the clinic every day for. A doctor can prescribe a prescription for it. And both methadone and buprenorphine bind to the same receptor as heroin, for example, but without producing the high effect. And I could explain that more in geeky language. Does anybody notice my tie today, the periodic table? So I can get super geeky if you want me to later. But right, they do kind of the same thing, but there's some important differences so that they, when properly dosed, they don't get people high. So it's not just one addiction for another. Let's see here, I have to take my glasses off to see. And then there's a medication, naltrexone, available in a monthly injection, which blocks the effects of heroin and other opioids. So that can also be a really helpful. So that actually does the opposite of heroin. It blocks, if you have this monthly injection and you used heroin, you feel nothing, and it's a waste of your time and money. And then I want to talk about Narcan as well. So truthfully, I 90% of the time carry my Narcan kit with me, and I open it up and I don't have it in my backpack today. But that reverses overdose, and so that's a big push now to try to get everybody a Narcan kit. So if anybody wants a Narcan kit, come see me afterwards. Give me your name, date of birth, pharmacy telephone number. I'll call it in for you. And the training for it, there's an app called Opie Rescue that teaches you how to use it, or you could contact me and I can help you with that as well. But that is saving hundreds of lives, getting people Narcan kits. Let's see here. I had a few comments about marijuana too. Thank you, Kent, for stimulating my thoughts around that. Really marijuana now is not the same substance that was around when in the 60s, 70s, 80s, 90s. It used to be 2 to 3% THC by weight, and now routinely it's 20+% THC by weight. If people are using butane hash oil, it's 90% or more THC by weight. If people are dabbing marijuana, you can YouTube it, dabbing. It's just a totally, totally different way. It's not the same substance at all that we may be thinking of in the good old days. And so really I think we need to get the message out there that there's no known safe amount of marijuana use in pregnancy. You'd think that we could all agree on that, but actually a recent study showed 70% of bud tenders recommended marijuana to pregnant women in the first trimester. So we need to get that information out. No known safe amount of marijuana use in pregnancy. No known safe amount of marijuana use in adolescence. So thank goodness, vast majority of adolescents who use marijuana turn out just fine. But you see that the rates of psychosis and schizophrenia really start going up after 10 exposures to marijuana in adolescence. So that's a finding that we can talk more about later, but has been repeated about a dozen times now since the 1980s, that connection between adolescent marijuana use and subsequent schizophrenia. And the issue is that marijuana binds to the very receptor in the brain that helps control brain development. So hopefully we can get out the information. Really no known safe amount of marijuana use for adolescents. Brain's developing till age 25, as Kent said. And really, can I say something that's probably a little controversial? I truthfully think that, I'm not talking about medical use, okay? Setting medical use aside, I don't really think that there's adult recreational use of marijuana that leads to a flourishing life, is my personal opinion around that. So feel free to disagree with me on that. But and why do I think that? I think because marijuana, kind of by definition, leads to intoxication. I mean, why would you smoke marijuana if you didn't want to get high, right? And so it's the fact that it leads to intoxication that I think is important there. So I think those were my main thoughts, and I'll be eager to hear everybody else's thoughts and questions, comments, concerns at the end. So thank you for your time.